Welcome to the What Happens Next YouTube channel. What we're aiming to do with this channel is share content designed to make sure that you're supported through whatever's next in your life. And we'd love to continue to do that. I've got a favour to ask today, and what I'd ask you to do is just subscribe. It costs you nothing, but it really helps us deliver really good quality content on a consistent basis. Thank you, and let's go on to the interview. What would you say the things that we should look at to make sure we're living physically healthier lives? What do we ignore, and what did you see in your life as a nurse?
I think what was really fascinating, Chris, is that in the clinical environment, a lot of, not all doctors, but a lot of doctors and clinical people only look at that particular aspect of it.
Yeah.
So, for instance,
the disease, right? What's the disease?
Absolutely. Yeah. It's just the heart. So if we're going to take the heart, which was my speciality, it was, what's wrong with it? What's right with it? How do we make it better? And I was really fortunate that my cardiologist at the time was very much more interested in the whole holistic picture.
Yeah.
And actually, we were really fortunate to go work with a professor in Edinburgh who had already started to link anxiety and depression to a physical illness. But of course, the clinicians who were looking after those patients, in one sense, just pushed that aside. They weren't willing to maybe what else is going on here. We all know that we need to exercise, eat 5 portions of fruit and veg a day, get enough sleep, think positively. But what happens if that isn't happening? And is there a medical connotation that could happen because we're not doing that bit at the beginning? And I guess that's what I was seeing, Chris. People who had not looked after themselves in many, many different ways, whether that was physically or mentally, and the end result was, sort of this cardiac event.